Sterile injecting equipment, or freshies, are free and available from your local needle and syringe program, or NSP. These NSPs are all over Australia, and some are peer-led, meaning they're run by people who also inject drugs. Most of us know to use a new syringe each time we inject, but in order to be as safe as possible, every piece of equipment needs to be sterile, for example, spoons, water, filters, and tourniquets. To be sure that your equipment is sterile, it should always come in sealed packaging, which has a best before date. A new syringe or needle is made to be sharp. This reduces the chance of bruising and damage to the vein. After only one use, a needle sustains damage. This damage becomes worse with each subsequent use. So it's important not to reuse a needle, because as they become blunt, they cause tearing and scarring to your veins and surrounding tissue. Before we start mixing up, we need to wash our hands. Take off any rings or jewellery, wet your hands, apply enough soap to cover all of them and rub them together for about 20 seconds. Don't forget the backs of your hands and in between your fingers. When you're done, use clean paper towel to dry them. If you don't have access to soap and water, you can always use alcohol swabs to clean your hands. Pay attention to your fingertips and thumbs, because they're the parts we use when we're mixing up. Remember to always swab your injecting site before you inject, and then when you're done, use a clean tissue or cotton wool if you need to stop any bleeding. It's no good using a swab after the shot because the alcohol actually makes you bleed more. Always clean up after yourself. Used equipment needs to go into a sharps bin and then return it to the NSP. The final step in the process is washing your hands again. Yep, you heard me right. We need to wash our hands before and after each and every time we inject. For more information, please refer to AIVL's Vein Care Guide on our website or to a drug user-friendly service in your area.